that time of year when the sniffles begin. Here to help us determine when we have a cold and when we have the flu, plus how to deal with both, Dr. Marjorie Dixon. Marjorie. It's tough to figure it out. It's probably very clear to you. You're a doctor, but a lot of us will be like, well, I don't know. I'm feeling a little stuffy nose. It might be a flu. That's probably not right, is it?
No. If you have the flu, you feel it. So, you know, the coughing, sniffling, sneezing, feeling a little under the weather, needing to use tissues and not feeling well, that's you have a cold.
Right.
When you have a flu, you know that you have the flu. The flu is caused by a virus, influenza A and B virus, and it really is not just the sneezing, coughing, sniffling, but you have general aches and pains. You feel unwell. You really can't do anything. I've only had the flu once in my life. Yeah. So
and you were laid out.
I was laid out for 3 days, and I don't stop for it. I'm hyperactive, right? You know that.
100%.
Yeah. Mom, and it's just you don't have room, so you manage your symptoms. But that one time, there was nothing that I could do, and I did what we learn in medical school. So you have to do lots of fluids, and then you do the things you can do to help you feel better. As a physician who's in contact with a lot of people, and I see people who are actually at risk, so immune compromised, older, younger people, it's important for me to get the cornerstone of prevention, which is the flu shot.
Yes.
We get it every year. Doctors, healthcare providers, people who are working in senior citizen homes, in pediatric hospitals have to have it. It doesn't prevent it all the time. That's only 60% of the time. Even if you have the vaccination, you will still get at risk of having the flu. So now, what can you do to manage the symptoms if they happen, whether you have a cold or the flu? And then also, how can you help to prevent it maximally with things that happen? So what I do, I get the flu, I rush on over to the pharmacy Rexall store, and I'm like, I know, as a physician, it's kind of you're treated because you actually know what's in all of the medications and you know what you can use and what there's evidence for in the literature. So one of the things you must do to prevent the spread is wash your hands. My Jamaican mother was obsessive, and she was right, because you wash and you have to sing happy birthday to you, happy birthday, like a real hand wash. And if you don't have access to water and soap, then you want to use a hand sanitizer option. So hand sanitizer is really great, especially has greater than 50% ethanol, so the alcohol will help kill the viruses. And what happens in the spread is that people will sneeze into their hands. Don't sneeze into your hands, sneeze into your sleeve, sneeze into a tissue. So that's where you have tissues, because you want to be able to get rid, put it in the garbage, then go wash your hands or use your hand sanitizer. If you're thinking about immunity and boosting your immunity, so preventing you from actually getting it if you are exposed, vitamin C. So there have been a lot of studies looking at vitamin C and cold, and people thinking you take vitamin C, it prevents the flu. It does not prevent cold and flu. What it does do is it reduces the exacerbation of illness if you do get sick. So that's why it's important to keep your immune system in a happy place. Vitamin C supplementation is a good one, and you can get that from tablets, you can get that from juices, you can get that from actual fruits.
So it's not going to prevent it, but maybe you're not going to fall as hard. Because you've been boosted with that.
Because you're boosting your immune system. And actually now there's been years and years of literature. There was a giant meta-analysis. So in the medical literature, you need a doctor to kind of look at what the quality of the study was and what came out of it. And actually that's what's come out of it. So it doesn't prevent you, but it shortens the duration, just as would the vaccine. So when we talk about what it does, it will help you manage if you do get sick in shortening the exacerbation of it.
Because we got to get back to work, right? You're just trying to get back to life, so it's good that it'll make it shorter.
Mama, you never get sick. Don't you want to stay home?
There's too much to do,
I'm like, wait, baby, when you're mama, there's too much to do. So then furthermore, then you comb the aisles and you're looking for things to manage. So what are the symptoms? When I said you feel like aches and pains, if you have fever that's associated with it, if you have a really high fever, that's generally the flu, that you want to take an acetaminophen or a Tylenol-based product, acetaminophen, or ibuprofen as well. Those things you can also get just at the pharmacy in and of themselves. But then if you also have stuffy nose, you take an antihistamine, or the antihistamine also can have a somnolent effect. So in the nighttime, whether it's liquid or the nighttime effervescence or nighttime tablets, those have an additional somnolence effect.
That makes you sleep?
It helps you. So if you're coughing, sneezing, and you're trying to sleep at night because you want to get your rest, that will help you. So that's what the nighttime formulation. So you go to the pharmacy, what is in this nighttime formulation? So it also has a combination. So you can buy the things individually. You can buy them as liquids. You can buy them as capsules. You can buy them mixed into morning and evening so you don't have the somnolence. So if you're trying to go to work, you're not snoozing.
You don't want the sleepy
Right?
one.
You don't want the sleepy one. If you have a really bad cold, there's also Vapo.
Yes.
So you can put
rubs.
it on your chest. That really, it has the camphor and eucalyptus, again,
Opens
Jamaican
it up.
mother. It helps you feel like cough suppressing.
Yes.
The vapors also tend to kind of help with the decongesting a little bit.
100,
so,
yeah.
But don't ingest it. Sometimes patients tell me, I took a spoon of it. Do not. It's not made to be ingested.
Oh, no.
No. Yeah, I'm just saying.
Yeah,
I just heard
topical.
it. I'm not
Rub
going
it
to
on.
topical on the outside.
Yes.
And then another one is if you are stuffy and you have mucus in your nasal passages, a real nice saline rinse. So you actually hold a nostril, you inhale it, and it helps to loosen up the mucus. Some people like it, some people don't like it.
People love it that use it.
And then, of course, tissue, wash your hands, hand sanitizer. So that's what you want to do.
Tons and tons and tons. Really quickly before we go, I just want to separate the myth from the fact here. So I'm going to give you a statement. You tell me if it's a myth and correct me if I'm wrong. You can catch the flu from the vaccine. People assume that because they got sick after getting the vaccine, the shot caused it. Is this true? It's not.
People say it all the time. It's inactivated. It's an activated vaccine. Dead. So
it's a dead.
Yes.
You're not getting an active flu.
You're not. If you get the flu after having the flu shot, then that means that you were already exposed to the virus and you were about to get sick.
Right. Okay. It was already coming for you. So getting the flu, it was coming for you. Getting the flu vaccination is all you need to protect yourself from the flu. Is that myth or fact?
Fact. Not.
Not a fact. It is a myth.
I just confused my own self. No, it's
But
a
then you
myth.
fixed it. Okay.
It's a myth because, yes, as I said, 60% of the time, but if you want to boost your immune system, you want to prevent the spread, you want to wash your hands. So those are all, it's a combination, an amalgam.
Okay, all right. One other thing, you can't spread the flu if you're feeling well. That is a myth.
Giant myth. So 20 to 30% of people walking around healthy actually carry the virus.
Stay away from me. And there's no way you would know.
You would not know. So take precautions, and if you do
Yeah.
get sick, manage your symptoms, and hopefully you can get back to work.
To help